Hi, I'm Michelle Steigleder, and this is my opportunity to let you get to know a little bit about me. I'd like to thank you for visiting the website, Texas Telehealth. Before I begin talking, I'd like to request that you take some time to visit the credential page. Anytime you're working with people on the internet, you may not be so sure if they're credible. So take some time and look at our credentials. Dr. Greenleaf and I are licensed professionals. She is a clinical social worker, and I am a clinical psychologist. We've been in this psychotherapy business for 23, 25 years, a long time. Tele-mental health therapy is a new way of receiving psychotherapy. Dr. Greenleaf and I are really excited about it, not only because it is more flexible and convenient, but one of the most exciting and wonderful things for both of us is the fact that people who never before had access to psychotherapy now have that opportunity. Unlike many clinicians, I have worked in several other fields before I trained as a clinical psychologist. I have experience working in business, and I know what it's like to work really long hours, to be on the road, to be away from family and friends, and how difficult it can be to maintain a solid family life and a social life as well. I treat a wide variety of problems and difficulties, from major depression to anxiety, post-traumatic stress, bipolar disorder. I also treat adjustments that we all experience just from the very fact that we're alive. My orientation is a blend of cognitive behavioral therapy, Eastern psychological principles, and dynamic constructs. I also do psychological evaluations for folks who are in the process of getting authorized for weight loss surgery. I think about therapy in a very pragmatic way. I expect that what you discover about yourself and what we learn together will be transformed and translated into a better quality of your life. I understand that what brings people into treatment is pain. Of course, people do come at times for personal growth and for trying to figure out why they do the things they do, and maybe even to have a better understanding about how their own mind works. But for the vast majority of people, what brings them into treatment is pain and emotional suffering. The belief that nothing will ever change, things will always be painful. It's a very dark place to be. I know that it doesn't have to be that way, and I know that change certainly is possible and it is doable. I know that from my clinical experience, and I know that because I live in this world as well. I'd like to close with one of the observations of a patient of mine. And what she said was, therapy didn't save my life, it gave me a life. And this is what I wish for each and every one of the people who work with me. My hope is that the quality of their life, the level of enjoyment and satisfaction will increase tremendously. I'm going to stop right there, and thanks for coming, and I hope we have the opportunity to work together. Bye-bye.